Hello and welcome. Today we're delving into a condition that affects male fertility, oligospermia. We'll explore what it is, what causes it, how it impacts the body, and what can be done about it. So, let's begin our journey into understanding oligospermia. Oligospermia isn't a disease that pops up out of nowhere. Several factors can contribute to its development. These range from hormonal imbalances, where hormones like testosterone aren't being produced or regulated correctly, to varicocele, which are enlarged veins in the scrotum that can increase testicular temperature and impair sperm production. Genetic factors like chromosomal abnormalities, infections like epididymitis or orchitis, exposure to toxins like pesticides or heavy metals, and lifestyle choices such as smoking, excessive alcohol consumption, and drug use all play a role. Also, medical conditions like diabetes and certain autoimmune diseases can impact sperm production. Sometimes, the cause of oligospermia remains unknown, classified as idiopathic. To understand how oligospermia affects the body, we need to look at the normal sperm production process. Spermatozoa are produced in the seminiferous tubules within the testes. This process, called spermatogenesis, is heavily reliant on hormonal signals, optimal temperature, and a healthy testicular environment. In oligospermia, this process is disrupted. Varicoceles, for instance, raise the temperature of the testes, impairing spermatogenesis. Hormonal imbalances interfere with the signaling pathways necessary for sperm production. Genetic defects can directly affect the development of sperm cells, and infections can cause inflammation and damage to testicular tissue. Ultimately, these disruptions lead to a lower than normal concentration of sperm in the ejaculate. When it comes to how common oligospermia is, precise figures are hard to come by, as many men may be unaware they have the condition until they try to conceive. Studies suggest that it affects a significant percentage of men experiencing infertility, contributing to roughly 20–40% of male infertility cases. The prevalence can vary depending on factors like geographic location, lifestyle, and access to healthcare. It's important to note that infertility itself is a relatively common issue, impacting millions of couples worldwide, and oligospermia is a significant contributor. The primary symptom of oligospermia is difficulty conceiving a child. In many cases, it is the only noticeable sign. Some men might also experience symptoms related to underlying causes, such as pain or swelling in the testicles associated with a varicocele. Hormonal imbalances, if present, can lead to decreased libido, erectile dysfunction, or changes in secondary sexual characteristics, such as a reduction in facial or body hair. However, these symptoms are not always present, and many men with oligospermia may not experience any noticeable symptoms besides difficulty with fertility. Diagnosing oligospermia involves a comprehensive evaluation. The cornerstone of diagnosis is a semen analysis. This test measures sperm concentration, motility, and morphology. According to World Health Organization, WHO criteria, oligospermia is defined as a sperm concentration of less than 15 million sperm per milliliter of semen. If oligospermia is confirmed, further investigations may be conducted to determine the underlying cause. These may include blood tests to assess hormone levels, genetic testing to identify chromosomal abnormalities, and scrotal ultrasound to detect varicoceles or other structural abnormalities. A thorough medical history and physical examination are also essential components of the diagnostic process. While there aren't distinct classifications of oligospermia in the same way as some other diseases, it is often described based on severity. Mild oligospermia indicates a sperm concentration slightly below the normal range, whereas moderate or severe oligospermia indicates a significantly lower sperm concentration. Another way is using a count of sperm. Cryptospermia describes the state of severely low sperm counts, often with so few sperm in the ejaculate that they are difficult to detect. However, the treatment approach is usually determined by the cause, and the severity influences the likelihood of natural conception. Treatment for oligospermia depends heavily on the underlying cause. For varicocele, surgical repair or embolization may be recommended. Hormonal imbalances can be addressed with hormone therapy. Infections are treated with antibiotics. Lifestyle modifications, such as quitting smoking, reducing alcohol consumption, and avoiding exposure to toxins are also crucial. Assisted reproductive technologies and ART, such as intrauterine insemination (IU) or in vitro fertilization (IVF), can be used to bypass the need for high sperm concentration and facilitate conception. In severe cases, sperm retrieval techniques such as testicular sperm extraction (TESE) may be necessary to obtain sperm for IVF. Preventing oligospermia can involve lifestyle choices and avoiding known risk factors. Maintaining a healthy lifestyle with a balanced diet, regular exercise, and adequate sleep is crucial. Avoiding smoking, excessive alcohol consumption, and drug use is also important. Limiting exposure to environmental toxins, such as pesticides and heavy metals, can further reduce the risk. Prompt treatment of infections, particularly those affecting the reproductive system, can prevent long-term damage. Also, regular self-examination of the testicles can help detect varicosilas early. Although not all causes of oligospermia are preventable, these measures can significantly reduce the risk. The prognosis for men with oligospermia varies depending on the underlying cause and the severity of the condition. In many cases, with appropriate treatment and lifestyle modifications, sperm count can be improved and natural conception becomes possible. Even in cases where natural conception is not feasible, assisted reproductive technologies offer excellent chances of fatherhood. Ongoing research focuses on developing new treatments to improve sperm production and function. This includes exploring novel hormone therapies, genetic interventions, and advanced techniques for sperm selection and processing. The field is constantly evolving, offering hope and improved outcomes for men with oligospermia. Thank you for watching.